Hello and welcome to the OT Schoolhouse Podcast, your source for school-based occupational therapy tips, interviews, and professional development. Now, to get the conversation started, here is your host, Jayson Davies. Class is officially in session.
Hi, everyone, and welcome to the OT Schoolhouse Podcast, episode number 44. My name is Jayson Davies, your host as always. It's been great getting back into the podcast, back into the swing of things. I'm enjoying working with my A to Z school-based OT course cohort. That has been a lot of fun this past week or two. And yeah, we're going to keep this introduction short. Today, we are talking about the OTA, occupational therapy assistant relationship with two very special guests. The first is the occupational therapist in the group. I will mention her first. Her name is Mary Kleinheksel, and she is also joined by her occupational therapy assistant, and her name is Cait Bowen. You may know her as Cait the COTA on Instagram. She and the OT that she works with are joining us today, so we're going to get into that. But first, I do need to say a special thank you to the Pencil Grip for sponsoring today's episode of the OT Schoolhouse Podcast. The Pencil Grip is the original ergonomic writing aid. Writing becomes easy and natural. The pencil grip improves handwriting, helps to give more control, and reduces hand fatigue. Its unique patent design gently encourages the fingers and hand to rest in the proper position for gripping, the tripod grip. Unlike other grips, the pencil grip feels natural because of its ergonomic design and soft, flexible, latex-free material. Get yours at thepencilgrip.com and use promo code OTSchoolhouse to get 30% off your entire order. All right, like I said, we're going to keep today's introduction very short and sweet. So let's jump into our interview with Mary and Cait and talk about the OT-OTA relationship. Hi, Cait. Hi, Mary. How are you both doing this evening?
Hi, good. How are you?
Hi,
Great.
good.
All right, so I'm going to, so other people know I can see you, but they can't. Mary, why don't you go ahead and share with us a little bit about your background as an occupational therapist?
Okay, I have been an occupational therapist for 29 years. 20 of those have been at Jayson Public Schools, where Cait and I currently work together. I've done a lot of things prior to that: outpatient, inpatient, home health care, hand therapy, you name it. But I've landed in school OT as my passion. So.
Awesome. Fantastic. And then also joining us today is Cait. Cait, how about you go ahead and introduce yourself?
Sure. This is my 5th school year as a COTA, and this is actually the only OT job I've ever had. So I started off as a social worker, and that wasn't really my thing. So I went back to school for OT to become an OT assistant, and this is my first job out of college.
Wow. So already a lifer school-based OT.
Yes.
Yes.
All
Happy to
right.
be here.
Great. Well, welcome to the show. I'm so happy to have you. This is the first time that we've had an OTA team join the podcast. And I think this is something that people, all the listeners are really going to appreciate. So I'm excited. I hope you guys are excited to share your knowledge.
Yeah.
Yes.
Great. All right. And before we get started, Mary, you kind of mentioned the district that you guys work for, but geographically, whereabout is that?
So Jayson, Michigan is a public school. It is Western Michigan, about 20, 30 miles east of Lake Michigan. It's in the lower part of Michigan there.
Great. And again, the main reason that we're talking today is to discuss the relationship, the working relationship between an OT and an OTA. So we're going to dive into not only the actual work skills, but the interpersonal skills a little bit, because I'm sure that's an interesting dynamic. I know I've worked with a few COTAs or OTAs, and you really have to have some teamwork. And it sounds like you guys have some good teamwork. So I know there's probably OTs and as well as COTAs out there that have never had that chance to work with the other before. And I think that there may also be some people that just don't understand that dynamic. So this is going to be awesome. And I hope you guys are excited about this. So to start things off, I wanted to kick into just a little bit, again, the background. Are you guys district employees? Are you county employees? How does that work?
We are district employees as of, what was it, Mary, a couple years ago?
I think it's their 4th year, that they hired us on. Yeah.
So before that, we were independent contractors.
Oh, okay. And were you guys working for another contractor, or you yourself were the contractor?
We were the contractor.
Gotcha. So each of you were independent then.
Yep.
Yeah.
Huh, interesting dynamic. So then they decided that after a few years, it was worth just bringing you on board, huh?
Yeah, it's been really nice. There's some added benefits to being a district employee. It's kind of nice to not have to worry about the self-employment tax situation.
Right. That's complicated.
Yes.
So
Yeah, I definitely prefer it being in. Yeah, I appreciate our district doing that for us.
oh yeah.
Sure.
Yeah, for
Mhm.
sure.
So you've been with that district either as an employee or independent contractor for a little while then, Mary, right?
Right. So 16 years independent, and then the 4 years now I'm a district employee.
And so
Work-
you're liking being an actual employee?
Yes, pension and
Awesome.
definitely.
Cool.
All that good stuff.
All good stuff.
I know that good feeling. Yep. It's nice to have that behind you, I guess, or just kind of being taken care of without you having to really worry about it.
Yeah.
Cool. So, and then are you the only OT and OTA in the district, or are there others within the district as well?
So
We have
yeah.
one other part-time COTA.
Okay. And so, Mary, you also supervise that COTA as well?
Yep. So it was I came on the scene and took over some hours for another one. So I'm the only OT of the district. And then Kate took over a previous COTA who was there like 20 years before her.
Oh, wow.
Yeah. And she recommended Kate. And we interviewed Kate immediately. We were like, that's the one. We didn't look at Kate. The special ed director and I were like, yep, we want Kate. So yeah. And then Kate and I got so busy that we were both like, we needed help. So we wrote a proposal, and yeah, the district then approved our proposal for another part-time OT assistant, who we love as well.
That's
Jody.
great.
Yay, Jody.
Awesome. Shout out to Jody. Awesome.
Shout out to Jody.
Great. So how many schools are in your district then?
So
Ish.
yeah, so we Kate and I both work at 10 different schools.
Okay.
And then Jody works at 2 of
Okay.
those 10. So yeah.
Great. So you guys are busy and married. That means, well, Kate too, if you have 10 schools, you're traveling around. But
Yeah,
Mary,
super busy.
yeah, cool. So we're going to get into the dynamic about all of that. The first area that I kind of wanted to talk about was kind of communication. So I have some various questions that kind of I consider fall under the communication aspect. And I think many OTs and OTAs out there have the same types of questions. So the first one is a mentorship/supervision question. You know, what does that actually look like? How do you guys work together?
Go ahead, Kate. You wanna? Yeah. What do you think,
That's a
Kate?
good question. So Mary and I meet once a week to just kind of go over how the week has been, anything that may have come up, looking ahead to the next week. But that's really the only time during the week that we have together. The rest of the time, we're so busy with our own caseloads that we communicate through text or through email. But we save the big stuff for our once a week meeting.
Okay. And so again, going a little bit further in that once a week meeting, do you guys take like kind of formal notes or anything, or is it just very open?
I
What does
would say
that
it's
look like?
pretty open. I usually have a list for Mary, and she's got a list going for me, and we just kind of go back and forth and work our way through our list. I give her any paperwork that I need to, and vice versa. I
Okay.
would say it's pretty informal, though.
Oh
Yeah.
yeah. Over coffee. We have to have coffee.
Yeah.
Right.
Yeah.
I know I used to meet up with my COTA sometimes at Starbucks
Yeah.
or and like the local burger joint or something, wherever
Yep.
we could find a table. So I
Yep.
get that.
No, I'd say definitely informal, but yeah, we still have lists, checklists, and stuff that we need to get through, and yeah, and we do. But
Hmm. So do you guys, and I'm not expecting this to be a yes, but do you go over the entire caseload every time you meet?
No.
no,
We would be there for hours and hours.
Right.
So we just go over, I would say maybe kids that have upcoming IEPs, new students on the caseload, any students that maybe had a tricky week. We focus on those ones for our meetings.
Okay. So a handful of kids that are coming up with meetings or were tricky. Okay. And then, so actually, this is great. I didn't realize that Kate, you've been with Mary for about 5 years. So I actually want to ask Mary then, how has the guidance been similar and changed over the 5 years working with a new occupational therapy assistant?
So good question. I think at first when Kate first came on, I went through and I made a list of scenarios of if this comes up, we probably will do this. So then Kate didn't have to feel like she had to ask me every single time, every single question she was questioned. She could reference that. I think that was helpful to Kate. So
Mhm.
For sure.
yeah, because there was a lot of things that Kate wasn't even sure that would come up, and she's like, "Oh, it was right in there." So, yeah. And if there were any questions, then she could. I mean, I'm available on phone all day long, so we make sure that we do that. But yeah, and then I just kind of, as we went, things that I felt were helpful, like Kate would be like, "Oh, this came up," and I'm like, "Oh, I didn't." You won't think of it in every single meeting, but oh, I have these reflex integration exercises. Well, what the heck? Here you go. Or, I think handwriting without tears would be a great continuing ed program for you and Jody, the other assistant, to go to, because that really is a treatment changer, and it was for me. So just
Mhm.
as things come up and that I think about them, and the question is asked, that then I'll just give some guidance and think things that helped me along the way.
Mhm. Um, so every state has different legislation. And the reason I ask this is I know as in California, we just changed from being able to supervise 2 OTAs to 3. But just like that, every state also has different guidance or different requirements for how much support you have to provide to an OTA. Is that something you went and studied before taking on an OTA, or do you? I mean, maybe in Michigan, are there very strict guidelines on how often you have to meet or how often you have to talk about a certain or the cases or whatnot? Do you know any of that?
I think we go by Medicaid as well. I don't know if you bill Medicaid. So that
Medi-Cal, same thing, yeah.
Medi-Cal. So yep. So our Medicaid here, that really needs to be done quarterly. But I feel for best practice that if we at least need to touch base weekly,
Mhm.
I think that's very important. So I think it's just my personal preference of best practice, and I think to keep connected with Kate as well, so Kate doesn't feel like she's just out there all alone and
Absolutely.
support,
Mhm.
because she gets tough kiddos too, but yeah,
Yep.
she's
Okay.
she's amazing.
Great. And so, Kate, then, when over the past 5 years that you've been a COTA, how have you felt like guidance, supervision? How has it been for you? Did you feel like you needed more support at the beginning versus you do now? Do you still need the same amount of support, or what's that feeling like?
I would say I definitely needed more in the beginning, especially as a new grad. I didn't have a whole lot of OT experience. So I relied a lot on Mary, lots of questions. I wrote a lot of things down. I probably bothered her too much asking questions. But I feel like over the 5 years, I've become more confident in my job, more confident in the requirements. And so my questions are less frequent than they used to be.
Hmm.
And I just feel more confident as a therapist.
Gotcha. Perfect. So then, Mary, back to you. How do you keep up to date? I mean, it's kind of for both of you, I guess, but how do you guys keep up to date with who's seen what kids and just kind of those things that you kind of have to have a lot of trust in someone, right? But so how do you keep track of what each other are doing almost? Does that make sense?
Yeah, no, it does. So we each have our own caseload. So even the special ed secretary will be like, this is Kate's caseload, this is Mary's caseload, this is Joey's caseload. So those kids will be under Kate. Of course, they're all supervised by me, but I think it's important for everybody to have their own caseload, and I think that helps for just to feel ownership. And we believe in the relationship Kate has with her caseload, her students, is better than I could just be swooping in and trying to do something. I think that's important that that the OT assistant has their own caseload as well. And of course,
Mhm.
it's supervised
Yeah.
by the OT. But
Mhm.
yeah, so we when Kate first came on, she was, my love is all students, but I really love working with students with autism.
Okay.
We have a categorical program. So I kept that. And a lot of times those are the trickier kids. And then Kate could decide when she was branching off kind of where she wanted to go. So Kate, if you want to let them know,
so my caseload is kind of a variety, I would say. I have students in the cognitively impaired program, emotionally impaired program. I've got some gen ed kids who just need a little extra help, some kids with developmental delays. It's kind of a variety, but it's fun.
Well, that's cool. So then you guys actually do, in a way, make up your own caseload. Obviously you work together, but you guys kind of work to each other's strengths then.
Yeah, I think so. Like,
I would say so. Mm-hmm.
Yeah, and if there's a tricky kid that I know is going to be tricky all around, I will just keep that student because that I just need to provide that level of, shall I say, supervision for that. So Kate doesn't have to worry about getting involved in something tricky like that. So I'll make sure I'll get a feeling at the initial IEP, the evaluation, and then if that's the case, I will definitely keep that student. So not to put Kate in any jeopardy, especially like
the best.
What was that?
Mary's the best.
You are though. You are amazing. You runs up, girl. So yeah. So I just don't want Kate to have to be involved in a deposition or anything. So I will make sure that stays in my court.
Absolutely. I can hear the dog. That's fine.
Sorry.
This is a dog. No, I always say it's a dog-friendly podcast, so he's welcome to join us. I love it. No, it's totally fine. Oh, man. It just makes me miss my dog a little bit now, but that's all right. So, Kate, I want to ask you this then. Mary was just talking about how she it's almost like screening, and I've been in the same situation. There's certain kids that you have to be careful with, and there's certain kids you almost feel like you need to hold on to, right? Mary, you just kind of said that. But Kate, how do you go about if there's like one kid who you feel like you need more assistance? What do you do? Obviously, you would talk to Mary at that one-to-one meeting that you guys have, but have you ever had to go further and ask for more assistance?
I really haven't. Mary does such a good job at that initial screening and evaluation of taking any kids that might have something tricky coming up in their future. For any kids I've had that have been more challenging, Mary has always been so available to me that I've never felt like I've been alone or had to come up with a solution on my own. I know that I can just text or call Mary, and she's right there to help me. And I've never had to go beyond that.
Perfect. That's great. That's nice when things work out that way. What about this? Have you ever had, because I've been in a similar situation to this, have you ever had a parent request that their student be seen by the OT versus the OTA?
You know what? In 20 years, I have not.
Wow. Very fortunate.
I am very fortunate. No, we have not. I think we just are a team. And I just explained at the IEP that Mrs. Bowen is in this building weekly. She will be seeing your students. And Kate does an amazing job. And I make sure the kudos goes to Kate and the parents know that as well. Mm-hmm. So but no, I have not. I think it's screened out by me prior. I don't know. Yeah, no, I don't let it get there. No way.
Good. That's good to hear. Similar to that, what about at IEPs? Do any of the parents request that the OTA be present because Kate's the one working with the child?
No, but again, not in years. I know. But what will happen though is Kate's my backup. So a lot of times I'm double scheduled unfortunately I can't be to both. And I'll ask Kate prior and I'll be like, Kate, can you cover me on this one? And she's very willing to do that. But just for clarity for staff, I think for scheduling as well, that I'm the paper pusher, and so they know that they need to contact me. But Kate and I are a team. So a lot of the teachers make a comment like, man, I want Kate's job. I want to just see the kids.
Right.
Like,
I've heard that a lot.
Yeah.
I guess I'm under the deal.
I don't know, Kate. You're amazing. So she just makes it look easy and sound easy. But
Kate or COTAs do have the fun part,
You really do.
Totally get that. I've met many OTAs where I'm like, well, do you ever think about going back and getting the masters and doing the OT? They're like, nope, I'm happy here. Don't want to go to IEPs. I'm good here, right? But so
Yes.
Kate, it does sound like you do attend a few IEPs. If Mary's double booked, what is that experience like for you?
Yeah, I've been to a few. Because I don't do them often, they are a little bit intimidating to me, just because I'm not used to that side of the job. I don't work a lot directly with parents. I'm just not used to those types of meetings. But Mary always does a good job of, kind of outlining what I need to talk about. And it's a student that I've been working with. So in that respect, I'm comfortable talking about their progress and what we've been working on and the goals that we're moving towards. They go fine, I would say.
Great. And so I kind of want to go another way, but you mentioned goals. And so how do you guys work as a team to develop goals? Do you just look at the progress and develop goals, or does Kate have input, or how does that work?
so at our meeting or whatever, so I'll look at the goals and the progress, and I'll be like, I think this is the next progression, but yet I'll run it by Kate and be like, Kate, what do you think? Does this look doable? Does this look like because Kate will be like, yeah, no. I'll be honestly, you're crazy. And I love that. I'm like, oh, good to know. Good to know. I mean, we need to obtain our goals and they need to be, realistic. So, but that's the feedback. It's really good. It's just a great feedback loop. Like Kate needs to let me know that's too much or so, but I'm the one that is in charge of developing the goals with Kate's guidance on who she's seeing, because it's not fair, I don't think, to just slap some goals down and expect, someone, I wouldn't want that if they're so lofty that I know I'm not going to get them achieved. So I think it's important for Kate to give me feedback, and she does a really good job.
Awesome. And then, so what about the kids? So obviously there's kids on Kate's caseload. They're also on your caseload, but you're not seeing them, right? Or at least not as frequently as Kate.
Yep.
Do you have a certain system in place for when you're about to go to that IEP? I know for me, I hated walking into an IEP for a kid that I hadn't seen in a long time. And so do you kind of have a system in place when you're in that similar situation for a kid that's maybe is doing great with Kate, but you just haven't seen them in a while?
Yeah, so Kate will give me whether she'll text me something like a work sample. She'll attach a work sample for me, or a sample of what the goal was. She just recently there was a typing goal. So she's like, look at the typing, she'll do a lot of the handwriting samples for me, which is great. And I can see it right there, hand it to the parents. And then, like I said, prior to that weekly meeting, make sure that I touch base with her before the IEP. Any concerns? Like there was one girl that glasses, she didn't have her eyeglasses, and so Kate advocated for that, saying you really need to help me with that. So we went in the IEP, and the physical therapist and I advocated to and it's done. So
That's funny because I've had at least 3 kids where I've had to do the same exact thing, whether the kid lost their glasses, whether they broke their glasses, whatever it might be. There's always seems to be a kid that's not wearing the glasses that they need, or just hasn't got the prescription updated or whatever. But it's almost like you haven't been a school-based OT until you've had to talk to parents about finding the kids' glasses. So, all right. Well, we're about halfway through our podcast for today's episode. And so again, I want to thank the Pencil Grip for sponsoring this episode of the OT Schoolhouse podcast. The Pencil Grip was designed by a doctor and is widely used in classrooms, at home, and in therapeutic settings. The unique shape of the grip is designed to be a one-size-fits-all to help the hands of kids and adults and work with both righties and lefties. The Pencil Grip can be used as a training tool and then permanently for added comfort. The Pencil Grip fits on pencils, primary pencils, pens, crayons, markers, paintbrushes, etc., so its benefits can be widely enjoyed. A comfortable hand has more control and shows improved handwriting. The Pencil Grip guides the hand into an ergonomic position. It relieves hand pain, reduces fatigue, and improves comfort. Consistent use teaches and reinforces the proper grip and stops common problems like fist grips, thumb wrapping, and white knuckling. Parents, teachers, and occupational therapists widely recommend using the pencil grip. Check it out for yourself at thepencilgrip.com and use promo code OTSchoolhouse for 30% off your entire order. All right, well, let's jump back into it with Kate and Mary. And this next question actually comes from an Instagram follower of the OT Schoolhouse. And her question is, how important is it to rely on the OTA for progress on goals?
I'll let Kate answer that one.
Yeah, I write my own progress notes for my students, and then how we do it is I write them all out, and then at the end of that week, when I'm done writing them, I sit down with Mary, and we go through one by one, just so that she can get a visual too of where each student is at, how goals are going, and just so that we're on the same page.
Perfect. Sounds great. Yeah, it's nice when you have a team that knows how to work together and things just work well. It's very, very fortunate. I like it. All right. So what about services? You're in an IEP. You've gone over those present levels that it sounds like Kate really helps with. You guys have collaborated to develop some goals. And what about services? Who brings those up, or how do those get determined, or whatnot?
So the frequency of service?
Correct. Frequency, yeah.
So we write a range. We're lucky here that we are able to write a range of time. So we can write it monthly, and then I make sure that Kate will be able to meet that, whether it's snow days, that we have one coming up in a couple days here, that kind of thing. Monthly, we're not expected to backtrack and see those students. Correct. So by that, we do write a range. Kate sees students in groups. So we usually write a range monthly in there to cover that.
That's really nice to have that leniency. We don't have that here in the district I work for. But anyways, I don't want to tear any OTA relationships up, but has there ever been a time when you guys have been in a little bit of a disagreement about goals or the frequency of services?
Have we ever had a disagreement, Mary?
I don't think so. Maybe over who's going to buy coffee, right? It's my turn. No, I think too.
So.
No, because discharge for us is based on standardized testing. So a child has to reach average.
Picking up a student.
Yeah. So it's picking up a student. So it's not like, so it's based on data. I think that helps. So, I can't think of anything that we both are like. So
do you guys obviously you need the data to discharge, exit, graduate, whatever your term you want to use. But what about at the annuals in between? Do you keep most of the kids at a pretty consistent rate, or do you ever decrease kids based upon, they're meeting all their goals, or does that remain pretty steady?
We actually do testing each yearly. Oh. We do. We test yearly, and for standardized testing, we do test yearly. So
is that a Michigan thing, or is that just something your district and you have decided to do?
That's our district. Yep. Why keep a student on for 2 more years if they're average, fine motor, visual motor, that type of thing? So, yep. And as long as the IEP team is in agreement. So now if they're eligible under, let's say, otherwise health impairment under an OT eligibility, then we need to do a reeval if that's the case, like if that makes sense, on an official form to then make it official for a reeval. But yes.
Wait, okay. So a reeval, you making it sound like they're different. So in my school or my district, we one eval is an eval. We do it every 3 years for the triennial. But you're saying you'll actually do some standardized testing every year for some kids.
Correct.
Okay. Yeah. And so what does that look like?
So that looks like maybe a Beery visual motor or Beery motor, maybe a Peabody developmental motor scales for a preschooler. Yes. So, So we will get standardized data and test on them yearly to show, that's a good way to show growth as well.
Yeah.
And you can give a test if you've given it a year, the same test.
So do you do a full write-up for that, or are you just kind of doing the standardized just to show that actual assessment in the meeting?
So then I'll put that in the present level.
Okay.
Of the IEP.
Okay. So not a complete write-up. And that's what you're talking about for the other students, where you might do a complete report write-up?
Correct. Which we call a reevaluation. Yes.
Okay. Yeah. Okay. And so what does that look like then, the reevaluation?
So that has to be done at least every 3 years. It could be done prior, but usually it's a full team reevaluation. Very few instances that OT is the only one on an IEP.
Yeah.
So yeah, and eligibility, we only have like 13 eligibilities in Michigan.
Yeah.
So yeah, I don't know if that's the case with you, but yeah.
Yeah, I think that's pretty standard. I could be wrong, but I think that's pretty standard. Okay, so there are some kids, that is new to me though, is that you made it sound like there are some kids that receive only OT on an IEP. That
Correct.
is not something in California that we do. And IDEA, it must be a state thing. And so how many kids, estimate do you have that are OT only?
At this point, we don't have any.
Okay.
It's very rare.
So it's very rare. Okay.
It would be under an otherwise health impairment, such as it has to have an outside medical diagnosis.
Yeah. Yeah.
So perhaps then, they didn't test out, or they have more goals that they need for.
I think we had one, Mary, and we graduated him in the fall.
Yep. I think
Okay.
that was our last one. Prior to that, maybe one other one that I can think of. Very rare, but occasionally does happen where like speech was on and PT, but then they both discharged. And our standardized testing showed that he still required or could benefit from OT service.
Gotcha. Okay. See, that's the thing in our district right now is that there's the speech only kids. And the argument is that, at least coming down from admin, is that they shouldn't have OT unless they have that specialized academic instruction, the SAI, because we're supposed to be helping the student in their education, right? And if they don't have specialized academic instruction, then what is OT supporting? But I understand how every district's a little bit different. But yeah, so that's interesting to hear what other states, how things happen. So cool.
Yeah.
All right. Well, we started down the evaluation route, so I want to go that way. And that is, how do you as a team handle evaluations, or Mary, do you do all the evaluations?
So I do all
Mary.
So I do all the initial evaluations.
Okay.
And then Kate helps with, then if there's a student of hers, she will gather data for me for any reevaluations. I feel that's helpful because she does have that relationship. I've had it before where I've come in, even if Kate's there, I'll sit down and the kid's like, no, I'm not working for you. And then Kate will be like, come on, let's do it. And then, so yeah.
That's when you got to bring the goldfish. Be like, you want goldfish? No, I'm just kidding.
Skittles.
Skittles. There you go. Does Kate ever do any actual formal assessments? I know some states allow it, as my I know in California, we can have OTAs actually do some formal evaluations. They are not capable of, or they're not allowed, not to say that they're not capable of it, many OTAs are capable of it, but they're not allowed to interpret the results. So does Kate actually provide, will she give the Peabody or the Berry?
Yes.
I give the berries, but I don't score them. So I will administer them to my students, and then I give them to Mary to score.
Okay. And so how does that work for you guys? Do you feel like you're able to get all the data you need from the interpretations, or not the interpretations, but from the actual protocol, as well as all the information, maybe the handwriting samples and stuff like that she provides you?
Yes, for sure. And then she takes notes for me. I show her what to look for. Please comment on this, like any fidgeting or that kind of thing, some clinical observations during it as well. So she definitely contributes to it as well. And that is allowed. I know, I believe our national association allows that as well. So.
Yeah. Yeah. Mm-hmm. So then, Kate, how do you feel about doing the standardized evaluations? Is it just the Berry that you're doing, or are there others?
Yep, those are the only ones that I do. I usually do the Berry visual motor, and I do the Berry motor coordination.
And those are pretty, once you learn them, they're pretty simple to administer.
I feel like I can do them in my sleep now.
Right? I think most of us can. Personally, I don't do the Berry because our psychologist likes to do the Berry. And so oftentimes she'll do it, but I don't get the information until we're at the IEP. And so I do the RAVMA, or the bot or something to help kind of get some of the things that I would get from the Berry. But
Yeah,
Everyone does it a little bit different, right?
that's right.
Mhm.
Yep.
All right. So you go through the evaluation, whether or not it's a 1-year evaluation or a 3-year evaluation, reevaluation. What are the steps, Mary, that you take after that to make sure that Cait knows the new information based upon the evaluation?
So I'll score it, and then based on when the IEP is, or sometimes I'll text her right away. Woohoo! He did it. He got an average. There's been a few big celebrations.
Yep.
Yeah, you were on a roll there. It was a lot of them. And it's really good feedback for Cait, whether her treatment's working. Is it, what I mean? That's good data
Mm-hmm.
to drive the treatment as well. Or, oh shoot, we're close, but we got to hang on there. So I will definitely share that with Cait before the IEP.
Okay. And then so I guess the question is, like, once you have the completed IEP, how do you relay that information to Cait on the new goals, any new information based upon whether it be things that the parent told you or insight that the teacher had during the IEP or something like that?
Yep. So I take notes on that IEP form. I'll copy it. We have it's called Power School, our IEP system.
Okay.
So I'll copy that document. I'll put Cait's copy at the top. I'll take notes on the back, what the parent said, because we have so many, we can't
Right.
can't remember those details. And then we'll meet over coffee and I'll
So you
relay
do it
it.
right then.
And then I give that document that is Cait's document for her to keep, because I have a copy in Power School electronically, and as well as I could put a copy in my files. So
Great.
Yep.
That works out well then. Cool.
it does work out. And there's that weekly meeting, I think, is important.
A key, right?
It is to keep up on everything.
Uh-huh. And so I have a question. You have a part-time COTA too. Do you meet with the part-time COTA individually, or is this a group team meeting?
Nope, I meet with her on a different day as well, individually. So because she's at a different school. So but fun side note, we're all going to meet, 3 of us actually, Thursday for Professional Development Day. Yay! We never get to meet all 3 of us.
Yeah.
We're excited.
It's like just hearing about this. I'm just kidding.
So
Awesome. Well, we're going to get into that in a minute, though, professional development. So hold on tight for that. Earlier, Cait, you touched upon a little bit of the documentation, and correct me if I'm wrong, but Mary, you have to co-sign all the notes, right? The daily progress notes, or is that not necessarily a thing?
that is not a thing in Michigan. We do not have to, we keep our own notes in our charts, but there's nothing for me to sign daily here, which is helpful. I think
Yeah.
maybe why it works so well. I do have to
Sure.
sign quarterly Medicaid. That's Medicaid notes.
Yeah.
But that's the only thing that I have to sign quarterly.
And so are your quarterly Medicaid notes, are those also the same notes that would potentially go home on like a report card or progress report for the kids, or do you guys not have to do that?
Nope, totally different. So Cait does the progress notes. I look at those progress notes, but I don't have to sign them.
Okay. But those progress notes do go home to the parents versus your progress or your note that you're doing for Medicaid is separate.
Correct. It's just for Medicaid. Yeah. And for like an audit. And we did get audited one time. So definitely was good. We were
they're doing a lot of stuff with Medicaid, Medi-Cal, all that stuff right now. It feels like they're trying to reorganize it a little bit, and it's crazy. I mean, we use a system called Paradigm, and we have to input our note every day at the end of the day, and it takes time. And I'm not the fastest typer. So it takes a little bit extra time.
Yeah.
But
we do as well weekly. We do our weekly Medicaid students after our session and
gotcha.
Weekly, and then I have to approve that monthly. So Cait inputs it daily or whatever after she sees it. And she does a monthly summary, and then I approve Cait's monthly summary, if that makes sense.
Yeah, that does make sense. It's amazing how things are so different from, obviously from one state to another, but I'm sure you guys have probably, Cait, you've been in this district forever, or since you've been in OTA,
Right.
but I mean, even when you go from just one district to another district, things can be so different. And of course, state to state, county to county, all that. It's crazy how different things can be. So it's kind of cool being able to talk to people from different regions.
Yeah.
I like it.
Cool.
All right. The last area I kind of wanted to touch upon is RTI. And RTI, again, response to intervention, for anyone who doesn't know it yet, check out episode 42, broke it down all there for you. It has 3 different tiers. We have that level 1 tier, level 2, level 3. I identify level 1 as being very general, very like trainings and stuff like that. Do you guys participate in trainings, both where you're the person being trained, as well as the OT or the OTA providing trainings?
So yeah, we do. So our RTI, we give training to the teachers, just general classroom teachers. They say we have students that need help with their handwriting. At that point, then we're like, try these techniques. And then we are requested to do some trainings for teachers as well, just let's say on fine motor as a whole. So we've done that. And I don't know, Kate, I don't know if you've done that with me.
No, I haven't.
I think that was at the Early Childhood Center. So I think Jody did that. So we'll do like a parent-child day where the parents come in, and we'll give an in-service on that as well. And the teachers are there. So various in-services for them. And then for us, I think it's more of like Kate and Jody just went to that Handwriting Without Tears conference, that type of thing.
Yeah, going to seminars and stuff like that. Very
Yeah.
cool. So what are you guys doing this Thursday for your PD day?
So we're working on that special, I was telling Jayson earlier, we have a special sensory equipment coming out. We can't quite say everything about it yet, but it'll be a big reveal soon. So we're going to work a little bit on that. And then that's actually in some of our schools right now that as a prototype.
wow.
So, and then, so we're going to work on tweaking that. And then preschool, actually RTI, Kate came up with this fantastic idea for RTI home activity boxes. If you want to elaborate on that.
I can't claim the credit for the original idea, but I did adapt it to fit our needs. So we call them Fancy Fingers Fine Motor Boxes. And basically they're just a box of fine motor tools that can be sent home with a student. But we rolled them out 2 years ago. I got some funding through Donors Choose, and we rolled out 35 boxes. So we really focus on the younger grades. We gave one to every kindergarten teacher and every preschool teacher. Is that right?
Yeah.
And so the boxes were a little bit different for preschool and for kindergarten, but we included instructions inside, and it was activities like pop beads or a tennis ball mouth or putty with beads, just things that we picked out to really work on those fine motor skills. And that's been a huge help. We got a great response from teachers for those. We've actually had to I just made 6 more in the fall, and we need to make some more for the preschool. So they've been very popular.
Awesome. So do these stay in the classroom or do they go home?
We kind of leave it up to the teacher. They can use them at their discretion. So some teachers like to use them as like part of a center as kids are going around the classroom, and that's helpful. If a kid is really struggling and the teacher feels like there will be follow through at home, we've left it up to them whether or not they want to send that home for a couple weeks and then send it back to school so that another kid can have it. We just kind of leave it up to them.
Okay. And then since I just asked you about sending things home, do you guys as an OTA team send home anything like homework? Do you give the child OT homework? Do you give them things to do at home or home exercise program or anything like that?
Yeah, I actually created monthly home exercise programs or activity lists, and we send those home every month to all of our students. And I just started sending home just some extra worksheets for students, things that we've been working on in our sessions that have been kind of challenging, just some extra practice at home.
Cool.
So we're really building up on that follow through outside of the therapy session.
That's awesome. And so you have an Instagram. account.
I do. Yes.
Are pictures of these items on your Instagram account?
You bet. I have pictures of our fine motor boxes. I have pictures of some of the things that I send home, and they're also available in my Teachers Pay Teachers store. Um, so people are welcome to check those out. It's just some great extra worksheets that they can send home or use in therapy or give to teachers.
Okay, so I know the easiest way to find your TPT, Teachers Pay Teachers account is probably through your Instagram. So what's your handle?
Kate the COTA.
Is it all, I can't remember, is it just Kate the Coder or does it have underscores in it?
Kate underscore the underscore COTA.
That's what I thought. Okay.
Yep.
Yeah, be sure to follow her. I follow her on Instagram,
Yeah.
so be sure to follow her. And if you didn't catch that, there will be a link to her Instagram on the show notes at otschoolhouse.com/episode 44. So yeah, be sure to follow her. And then I want to continue on the RTI route. So you talked about, Mary, how you do some trainings for teachers. We talked about how Kate will go, and the other COTA you probably do yourself because you have to have continuing education, going to seminars, going to things like that. What about the next step, level 2, kind of getting into potentially individual classrooms, doing groups of some sort? Are you guys able to do any of that?
So our level 2, we do a lot of the classroom adaptive equipment at that point. So we'll push in, we'll say try a slanted writing board. We've typed up handwriting legibility rules from Handwriting Without Tears that work amazing. We'll give pencil grips. We'll try different pencil weights. So at that point, we'll push in, give ideas, and then have them try that as well before moving forward with a pullout.
Okay.
Tier 3 for us is then the teacher's like, it's not working, then I'll get written parent permission for an OT evaluation for a pullout.
Gotcha.
Yep.
Okay, cool. So I think I meant to ask you this earlier, but do you guys do a lot of treatment in the classroom, or is most of it a pull-out session?
So I do a handful of treatments in the classroom. We've done it both ways. We've done small group pullouts. We've done push-ins. So I think it depends on the students.
Mm-hmm.
Definitely depends on the student needs. But for us, I think the quickest remediation is that pullout at this point, that we're able to still do that.
Mm-hmm.
We're pretty lucky about that. So.
Gotcha. Okay. But it sounds like at the same time, you're giving the teachers the materials they need, at least, especially in the preschool, kindergarten level with those boxes that you're talking about.
Yes, they have to, that's part of those systems that we talked about. They have to try these things first, and they find that, wow, it really did help. So then, wow, yeah, miraculously. So yeah, and it's all things that we're telling them that we're doing in therapy sessions. And two, I like when they send it home, then the parents alerted that it's an issue, and they can buy in before you send home a scary OT form. What? I didn't know anything was a problem. Well, they'll know before then. They're looped in to the process. That we found that really helps too.
Cool.
Yeah.
That's good. So I think we're getting down to the end. I want to ask each of you one more question. Don't kill me if it turns into 3 more questions, but for each of you, I'll start with Mary. As an experienced OT, what would be your piece of advice to an OT who is starting to supervise a COTA for the first time?
I would say the most important thing is have open communication. That's huge. Like just be open and allow communication to flow both ways. You got to be able to take things, have mutual respect as well. Kate is not my assistant. Kate is an assistant of Jayson Public Schools. I'm not necessarily my special ed director's OT. I'm Jayson. So yeah, just have mutual respect for each other. And I think that will go a long way, but that communication is key. Mm-hmm, for sure.
That's fantastic. But you did mention that whole supervision weird thing. I know in the past it's been a little complicated because you're the supervisor, but you're not their work supervisor. You supervise the actual therapy, not the actual person. I mean, you're not Kate's boss, right? She works
Right.
for, like you said, she works for the district. It's probably
Correct.
like the director of special education is officially her boss or something like that.
That is true. That is 100% true. Yes.
Yeah. And so I think that's just what I want to just clarify, because I don't think a lot of people understand that necessarily. And it is a very unique dynamic.
It is a unique dynamic. I think just the name of our occupations, it makes it confusing to others. And yes, I think that's perfect clarification.
Yeah, I mean, I think it even took me a while to realize that COTA stood for Certified Occupational Therapy Assistant versus Therapist Assistant. I mean, right out of school, it's like, wait, is it therapist? What does that even mean? Like, what's the difference? And then you come to realize, oh, that's why it's therapy assistant.
Therapy. Yes.
And I feel so lucky that Mary from day one has always made me feel like an equal. I have never felt like her assistant or just someone lower on the totem pole. It's always been an equal feeling, and I'm so thankful for that.
Great. That's good. Kudos to you, Mary.
Hey.
Love you, Mary.
Kate's amazing. You should see that. You guys go on her Instagram. She is very just talented. I'll tell you what.
All right. So, Kate, a similar question to you. You can't talk about communication because Mary just stole that one. But what piece of advice would you give to a new, to an OTA, maybe they're experienced, but they're kind of being supervised for the first time?
And I can't say communication. Come on.
I'll let it slide.
I just think it's so important to have that good relationship with the OT, just a place of trust, a place, like Mary said, of mutual respect, someone that you feel comfortable talking to about the good, about the bad, about the struggles. I think that's why Mary and I have been such a good team, is it's been so easy to talk to each other. And I think that's the biggest part.
Yeah, we can tell each other anything and just be
for sure
totally brutally honest.
Yeah.
Scary sometimes.
It is.
Well, that's great. It sounds like you guys have a wonderful relationship, both in work and the actual therapy itself, as well as outside of work. It sounds like you guys are doing things together, which is super cool. But yeah, thank you so much for coming on and sharing all that information. I'm sure many OTs and OTAs out there listening will find it comforting to kind of hear how things work. And maybe we didn't talk about too many struggles. It sounds like you guys are doing really well. But it's nice to know what a good working relationship can look like. And I think people will be able to take away a lot from hearing what you guys have had to say. So thank you so much. I appreciate it. For all of you listening out there, definitely do go check out Kate's Instagram, Kate_the_COTA. She has a lot of great information there. And on her homepage, I believe right now, she has the link to her Teachers Pay Teachers account too. So go check that out. If you don't know what TPT is, then I don't know what you've been doing in life. But TPT is amazing. They have so many free and paid resources. And so thank you so much for coming on the show. I appreciate it. And
thank you so much.
Yeah.
This was fun.
Nice.
And I hope we'll have to have you guys back on sometime when you guys have a little bit more info on the super secret sensory tool.
All right.
All right. Well, take care. Have a great evening, and I'll talk to you next time.
Thank you.
All right. And that wraps up episode number 44 of the OT Schoolhouse podcast. A very special thank you to Mary and Kate for coming on the show and explaining their OT-OTA relationship. They obviously have a great thing going on there. Thank you also to the Pencil Grip for sponsoring today's episode of the OT Schoolhouse podcast. I really appreciate all of you listening through this podcast, and we'll see you next time for episode 45 of the OT Schoolhouse podcast. Take care and have a fantastic week. Bye-bye.
Thank you for listening to the OT Schoolhouse podcast. For more ways to help you and your students succeed right now, head on over to otschoolhouse.com. Until next time, class is dismissed.